Sure, we're really excited about this work. We are presenting at this meeting on a cohort of over 40,000 patients from a large administrative database, and the entry criteria was 1 or greater doses of ADT. And so this is a mixture of locally advanced prostate cancer, metastatic prostate cancer, and castrate-resistant prostate cancer. So it's a very large data set. And what we are finding is that 99% of the patients were treated between 2010 and 2020. So it's a fairly modern cohort treated in the recent past. Interestingly, African American ethnicity or race is a protective factor for overall survival, even in multivariable analysis. So unlike conventional wisdom, where African American patients are felt to have a worse outcome with prostate cancer due to delay in diagnosis and social factors and various other factors, when a group of patients get to the point in time where they start ADT, so counting that time to eventual death or from any cause, we find that the African American patients are living longer, not shorter. Why is this? Well, no one really knows. It's possible that maybe the death rates earlier in their life were greater, say for kidney disease and heart disease. So perhaps once you get to that age where you might be developing an advanced or locally advanced prostate cancer and get started on ADT, you're left with a hardier or a more robust group of patients. Another factor that we found and others are finding is that high BMI is protective of survival. So in other words, once you get to the point of starting ADT, the men who were heavier actually had a better survival. Now that kind of makes sense, because what do patients die of from prostate cancer? They generally get to a cachectic state and kind of lose weight and eventually have maybe liver metastasis or bone pain, and they eventually succumb to the disease. So having extra weight on board at the time you're diagnosed with advanced disease or starting hormonal therapy actually is protective for overall survival, which again is counterintuitive. You know, we tell her, gotta lose weight, gotta stay thin, you know, it's good. And obviously in earlier points in life, that's good. Here, when we get to advanced prostate cancer, not that we should tell our patients to go out and pork up, but it is interesting that carrying extra weight, it does allow those patients to live longer. And now that I know this data, where I'm going to be more mindful would be, let's say I have a really thin patient who unfortunately comes in with metastatic prostate cancer. You know, perhaps should I be telling him to drink some Ensure? Should I tell him to really bulk up and use, you know, even take supplements like weightlifters do to get some weight, or just, you know, eat a lot of food and high calorie foods to try to gain weight? I'm not sure if we should send that message, but it is an interesting, intriguing concept.